Hey, it's Dr. Mike Borgett at Complete Wellness. If you're someone that is suffering with neck pain or low back pain, if you're having pain that goes down your arms, any numbness or tingling or weakness in your extremities, sciatic pain, spinal stenosis, facet syndrome, spinal decompression could be your solution. What you can expect coming into Complete Wellness is we will sit down with you, we will talk about your health history, we will look over any CT scans or MRIs that you can bring in our office. That's very helpful for us. Once we've looked at all the MRIs or CT scans that you have, we may take additional x-rays. This will help us pinpoint exactly the location of the damage and what is causing your symptoms. From there, we know exactly which protocol we need to do as far as frequency and duration of the spinal decompression. Not only can spinal decompression help alleviate your pain and symptoms very quickly, it's also a good long-term solution. Because the same thing that caused the disc to get injured in the first place will continue if the discs don't have a chance to heal properly. Spinal decompression has been proven to show pre and post MRI that the discs are actually healing and getting healthier so that they can be healthy for years and years to come.
Spinal disc degeneration is a very common occurrence. With modern day postures, people sitting at computers, the compressive loads cause discs to degenerate. In fact, amongst asymptomatic people in their 30s, 52% have disc degeneration, while in people in their 40s, 68% have disc degeneration. The loading on the disc tissue causes them to dehydrate, lose nutrients, and wear out over time. The lumbar discs are the most common area where this occurs. It also occurs in the neck. As we look at this lumbar disc, the nucleus pulposus will actually go through the weakened annular fibers, which is the white part, placing pressure on the adjacent nerve root, which can cause localized low back pain. It can also cause radiating pain down into the leg, down all the way to the foot. It can cause numbness, tingling, and even weakness. Spinal decompression pulls apart the discs, allowing for a negative pressure, and can cause the nucleus pulposus to then resorb back to its normal position, taking pressure off the nerve root. The annular fibers then get a chance to heal. This happens because with the negative pressure, oxygen, nutrients, blood flow can get pulled into the disc tissues so that they have a chance to actually heal, which is good not just to relieve pain, but it stops the degeneration process in its tracks. Non-surgical decompression is both highly safe and effective and has saved countless people from painful surgery.
Cervical spinal decompression, the patient will lie on their back. These two cushions will tighten down to support the occiput, or the upper part of the neck, lower part of the skull. This part will secure the head to the table, and just with a gentle force, it will Velcro to the table. Then on the actual machine, we will set the protocol to the exact setting and duration, and then the machine will do all of the work. With lumbar spinal decompression, there are two belts. One goes around the lumbar area, one goes around the thoracic area to keep her from moving down the table when the machine pulls. The belt tightens it further and then attaches to the machine. The settings are all based off of which discs need to be pulled and decompressed. Based off of the angle of the pull and the settings of the table, we can determine which disc we need to focus on the most.